Hi, my name is Maria, and today I'll be presenting an overview of syphilis, including what it is, how it spreads, the stages of infection, diagnosis, treatment, and prevention. So, syphilis is a sexually transmitted infection. It's caused by the bacterial pathogen Treponema pallidum, and its origin is unknown, but it first appeared in Europe in the late 1400s and caused a major epidemic. Many countries blamed each other for the outbreak, especially their enemies. For example, Italy named it the French disease, the French named it the Neapolitan disease, and others called it the Spanish disease, the Polish disease, and the Christian disease. And the most widely accepted theory of syphilis' origin is the Columbian theory, and this suggests that Christopher Columbus's crew brought it back to Europe from the Americas. And in 1905, two German scientists, Fritz Schaden and Erich Hoffmann, identified the bacterium that causes syphilis. And their discovery helped the development of both tests and treatments for the disease. And the image above shows a pathogen viewed with dark field microscopy, where it appears bright against a dark background. And the image below is a woodcut from the late 1400s of someone whose skin presents multiple lesions due to the disease. So syphilis is spread from person to person through sexual contact or direct contact with lesions of an infected person. And it can also be transmitted from mother to fetus through the placenta. And the primary sites of infection are skin abrasions and mucous membranes. This includes the genital, anal, and oral areas. And mucous membrane openings can all serve as entry points for the bacteria. So this includes the mouth, the lips, throat, vagina, cervix, urethra, placenta, penis, and anus. And these can be seen here. And it's important to note that syphilis is most commonly transmitted during its early stages when the infection is highly active and contagious. So according to the CDC, reported syphilis cases in the United States increased by 80% between 2018 and 2022. And globally, the World Health Organization estimates that around 8 million adults aged 15 to 49 acquired syphilis in 2022. Certain populations are at higher risk. This includes people in the sub-Saharan African region, men who have sex with men, people aged 25 to 34, sex workers, individuals living with HIV, and some ethnic minorities. And the blue line on the graph shows new cases in millions globally, and we can see how it's increased over the years. So T. pallidum, the bacterium that causes syphilis, has a long spiral-shaped structure, and it ranges from 6 to 20 micrometers in length, and about 0.1 to 0.2 micrometers in diameter. And its movement is powered by its endoflagella, which allow it to twist and move in a corkscrew-like motion. Additionally, this bacterium is an obligate parasite, so this means that it can only survive and reproduce inside of the human host and can't live in the environment. So T. pallidum has several virulence factors that help it cause disease. Its outer membrane has adhesins that bind to specific receptors on human cells. This allows the bacterium to invade tissues and invade the immune system. And its spiral shape and motility also help it move through tissues and spread into the blood and lymphatic system. It also produces the exoenzyme hyaluronidase, which breaks down tissue and helps it spread further in the body. It also grows very slowly at the site of infection, which also helps it evade the immune system. And this image shows how T. pallidum, although it's gram-negative, it lacks the lipopolysaccharide endotoxin on its outer membrane. So this allows it to evade the immune system as it spreads through the bloodstream and lymphatic system. So syphilis progresses through 4 different stages that produce unique signs and symptoms. Primary syphilis usually appears about 3 weeks after infection and can last anywhere from 10 to 90 days. And it's characterized by a hard, painless lesion called a canker, which forms at the site of the infection. And this can be on skin abrasions or mucous membranes in the genital, anal, and oral area, like the one seen here on the tongue. Because the canker is painless, it can go unnoticed and can even heal on its own. However, if the infection isn't treated, it can progress to the secondary stage of syphilis. Secondary syphilis occurs about 4 to 10 weeks after the canker from primary syphilis heals, and it's characterized by a non-itchy rash that affects both the skin and the mucous membranes. And the rash usually starts on the palms of the hands and the soles of the feet before spreading to the rest of the body. And infected mucous membranes may also develop wart-like lesions called condylomata. And other symptoms can include swollen lymph nodes and fever. And this stage is highly contagious and typically lasts 2 to 6 weeks. And we can see here how the rash spreads on the palms of the hands, the soles of the feet, and the rest of the body. Latent syphilis occurs after the symptoms of the secondary stage have ended. During this stage, there are no new symptoms, but the bacterium remains in the body for years if left untreated. So this stage can only be detected through blood test. And additionally, latent syphilis is divided into 2 phases, early latent and late latent. In early latent syphilis, the person is asymptomatic and they have been infected within the last year. They're also still contagious. In late latent syphilis, the person is also asymptomatic and has been infected for over a year, but they are no longer contagious. In tertiary syphilis, this occurs 10 to 30 years after the initial infection if the disease is left untreated. And it's characterized by large lesions called gummas that can damage mucous membranes, bones, and internal organs. And chronic inflammation from the persistent infection can affect the cardiovascular and nervous systems. In cardiovascular system, the aorta can rupture or the coronary arteries can be blocked, and this can be fatal. And in neurosyphilis, the central nervous system is damaged, leading to symptoms such as dementia, seizures, general paralysis, loss of vision, and hearing. And on the image, we can see a gumma lesion on the nose. And as I mentioned earlier, these can also appear in internal organs and bones. Congenital syphilis happens when an infected mother passes the infection to her baby during pregnancy through the placenta or at birth if she has an active lesion. And transmission is usually during the primary or secondary stage, especially if infection is untreated. And congenital syphilis can cause very serious outcomes, including miscarriage, stillbirth, deformities, damage to tissues and organs. And infants can also develop blindness, anemia, neurosyphilis, or cardiovascular complications. And on the image, we can see some of these effects on the baby. So syphilis can be detected using microscopic and blood tests. Dark field microscopy can identify the spiral shape of the pathogen, and samples are taken from lesions or tissue, and it is useful for diagnosing primary syphilis. Serological tests include treponemal and non-treponemal blood tests, and they can detect antibodies against the pathogen or antibodies against lipid antigens from damaged host cells. And both tests are recommended together to confirm a syphilis diagnosis, and they are used for secondary, latent, and tertiary syphilis. PCR testing can also detect the pathogen by amplifying its DNA, and neurosyphilis normally requires further evaluation of the cerebrospinal fluid. Additionally, congenital syphilis can be detected through prenatal blood test and PCR testing. The main treatment for syphilis is benzathine penicillin G, and it is given as an intramuscular injection. Treponema pallidum is highly susceptible to penicillin, which is why it's preferred treatment. And the dosage depends on the stage of infection. For primary, secondary, and early latent syphilis, a single dose is required. For late-latent syphilis or tertiary syphilis, 3 doses are required, 1 injection per week for 3 weeks. And neurosyphilis is treated differently. It requires an intravenous penicillin G for about 10 to 14 days. And for patients who are allergic to penicillin, there is alternative oral medications such as doxycycline or tetracycline that can be used. However, these alternatives are not recommended during pregnancy. There is currently no vaccine for syphilis, so prevention relies on safe practices and early detection. And practicing safe sex is one of the most effective ways to reduce the risk. This includes using condoms correctly and consistently, although that's not foolproof, and reducing the number of sexual partners. Routine screening is also important, especially for people in high-risk groups like men who have sex with men, and getting tested regularly allows for early detection and early treatment. Partner notification is also important. If someone tests positive, their partner should be tested and treated as well. This helps prevent transmission and your own reinfection. So syphilis can be diagnosed and treated in many outpatient or clinical settings. This includes public health, MSCD clinics, emergency departments, and primary care offices. For healthcare workers, standard precautions are enough. Isolation isn't required of the patient because syphilis isn't spread through casual contact. And patient education is a very important part of their care. So we need to explain the disease, how it's transmitted, how to prevent it, and what the treatment involves. All right, so that should be it. Here are some of my references, and thank you so much for listening.